Hey guys, Jim here. Welcome back to our Abdominal Sonography Registry review. Let's keep rocking this test. Question 51. This condition will cause an elevation in which of the following? A, LDH, B, AFP, C, AST, or D, PTT? This condition is known as fatty liver infiltration, which will cause an elevated levels of AST. Question 52. Assuming this thyroid mass measures greater than 2 centimeters, an FNA should be considered if what? A, the mass has mixed components. B, the mass has microcalcifications. C, the mass is predominantly solid. Or D, the mass is predominantly isoechoic. The answer is A, if the mass has mixed components. This ultrasound represents a patient who has papillary carcinoma. Question 53. Which liver segment is this tumor located in? A, 8, B, 5, C, 3, or D, 4B? In this image, the tumor is located right here, and this is in liver segment number 3. Question 54. Patients with this condition lose what sonographic appearance? A, periportal fat. B, complete visual loss of the portal veins. C, hyperechoic liver. Or D, hypoechoic kidney. Remember, this question is asking what sonographic appearance is lost when this condition occurs. So the answer to this question is A, you lose the periportal fat, which is the bright ring or lining of the portal vein. This condition is called hepatic steatosis, which causes the liver to accumulate fat, giving it a hyperechoic appearance on ultrasound. You can see here that the arrows are pointing to the hepatic veins, but you don't have the bright periportal fat around it. This question is asking, what do you lose with this condition? Well, you're not going to lose a hyperechoic liver, you're going to gain a hyperechoic liver. You're not going to lose the hypoechoic kidney appearance because the kidney is already more hypoechoic than the liver, especially in a patient with steatosis. And this choice isn't correct either because you're not going to lose the complete visual loss of the portal veins, just the periportal fat around it. Question 55. Click on the venosum. So where on this image would you click on the venosum? The venosum is right here, this line. Question 56. Which of the following is an abnormal measurement of the pancreatic head? A, 33 millimeters, B, 5 centimeters, C, 20 millimeters, or D, 2.5 centimeters? The answer is B, 5 centimeters. Make sure that you know how to convert from centimeters to millimeters and vice versa. Question 57. Click on the first liver segment. So where on this image is the first liver segment? The answer is right in this region here. Question 58. What does this ultrasound demonstrate, and what is the sonographic appearance? A. Pneumocystis carinii and ground glass. B. Focal fatty sparring and hypoechoic. C. Focal fatty infiltrate and hyperechoic. Or D. Lymphoma and hypoechoic. The answer is B, focal fatty sparring and hypoechoic. The infiltrate is located right here, this hypoechoic area of the liver. Question 59. What is the best reason as to why there is no color Doppler in this image? A, wall filter is too high. B, PRF is too low. C, Doppler angle is 90 degrees. Or D, packets are too high. The answer is A, the wall filter is too high. Question 60. What does this image demonstrate? A, medullary sponge kidney. B, tuberous sclerosis. C, amoebic abscess. Or D, steatosis. The answer is D, steatosis. Normally, the kidney will be a little bit more hypoechoic than the liver. Patients with steatosis will cause the liver to be a lot more hyperechoic, making the kidney look a lot more hypoechoic. Question 61. All of the following cause this condition except A, metabolic syndrome. B, obesity. C, poor diet and health. Or D, trauma. The answer is D, trauma. This is another example of steatosis, and the arrow is pointing towards a portal vein, indicating the loss of periportal fat here. Question 62. What artifact is shown here? A, range ambiguity. B, reverberation. C, mirror. Or D, comet tail. Be prepared for some physics questions on your boards. And the answer to this question is B, reverberation. Question 63. How does a heavily fatty liver affect the sonographic beam? A, easier to penetrate. B, less attenuation. C, harder to penetrate. Or D, does not affect the beam. The answer is C, harder to penetrate. Question 64. Which of the following is an abnormal measurement of the pancreatic body? A, 25 millimeters. B, 1.5 centimeters. C, 35 millimeters. Or D, 3 centimeters. The answer is C, 35 millimeters. Question 65. Which of the following is an abnormal measurement of the pancreatic tail? A, 2.5 centimeters. B, 15 millimeters. C, 1 centimeter. Or D, 20 millimeters. The answer is A, 2.5 centimeters. The best way to shuffle through all these options is to convert all of them to one unit. So let's say I use millimeters. All I have to do is move this decimal point one time to the right. This gives me 25 millimeters, which is bigger than 15 millimeters. Then I will convert this by moving the decimal point over one time. This will give me 10 millimeters. This is still bigger than this. And this is already converted to millimeters. So I know that this is the biggest option. Even if you don't know for sure the answer to this question, at least you can figure out the biggest number. And this question is asking for which one is abnormal. Well, I know that the biggest number will be the correct answer. Question 66. Click on the vessel responsible for perfusing this organ. So where will you click here? You really need to know your anatomy because these are called hotspot questions, and these questions are weighted more than any other question. The answer is right here. And knowing that this is the gallbladder, I know that the cystic artery will perfuse the gallbladder. And the cystic artery is right here. Question 67. This condition is usually caused by what? A, inflow obstruction. B, outflow obstruction. C, trauma. Or D, infection. Always make sure that you play through each video in its entirety because you might miss something at the end. The answer to this question is outflow obstruction, and this patient here has biliary hydrops. Question 68. What is the leading cause of cirrhosis in the United States? A, alcohol, B, hepatitis C, C, hepatitis B, or D, fatty liver disease? Alcohol used to be the leading cause of cirrhosis in the United States, but now it is hepatitis C. Question 69. Which of the following is an abnormal appendix measurement? A, 5 millimeters, B, 0.4 centimeters, C, 3 millimeters, or D, 0.8 centimeters? The answer is D, 0.8 centimeters or 8 millimeters. Question 70. Which of the following is considered a positive hypertrophic pyloric stenosis muscle wall measurement? A, 2 millimeters, B, 0.5 centimeters, C, 0.3 centimeters, or D, 3 millimeters? The answer is B, 0.5 centimeters or 5 millimeters. Question 71. Click on the third liver segment. You'll notice that this picture popped up a couple times before, and that's how these boards are. They will throw in pictures that will pop up multiple times, or you will notice that they'll ask the same question over and over, but worded a little bit differently. And sometimes those questions you see later on down the test will answer your previous question, because the previous question was asking which segment is this tumor in? And if you knew that question, you'll know this question. The liver segment is right here. Question 72. Which of the following is considered an abnormal pyloric channel length measurement? A, 2.7 centimeters, B, 14 millimeters, C, 1.4 centimeters, or D, 1.3 centimeters? The answer is A, 2.7 centimeters or 27 millimeters. Question 73. Which of the following is considered an abnormal cross-sectional pyloric diameter measurement? A, 11 millimeters, B, 1.2 centimeters, C, 1.6 centimeters, or D, 13 millimeters? The answer is C, 1.6 centimeters or 16 millimeters. Question 74. This ultrasound represents what as demonstrated by what sonographic indication? A, acalculous cholecystitis and double arc sign. B, cholelithiasis and wall echo shadow sign. C, porcelain gallbladder and acoustic shadowing. Or D, gallbladder carcinoma, and acoustic enhancement. The answer is C, porcelain gallbladder and acoustic shadowing. Question 75. What does this ultrasound demonstrate and where is this most commonly found? A, intussusception in proximal colon. B, pyloric stenosis between the stomach and the duodenum. C, ruptured appendix in proximal ascending colon. Or D, diverticulum and sigmoid colon. The answer is D, diverticulum, and it's more commonly found in the sigmoid colon. Well, that concludes the next 25 questions of this test. I do, however, have some extra questions, some bonus questions, just in case you're taking your boards before I can crank out the next video. So bonus question number 1, what is demonstrated in this ultrasound and what is it associated with? A, diffuse wall thickening and Gilbert syndrome. B, biliary sludge and prolonged fasting. C, chronic cholecystitis and hemolysis. Or D, cholelithiasis and cholecystitis. The answer is B, biliary sludge and prolonged fasting. Bonus question number 2. Which of the following is an abnormal measurement of the main pancreatic duct when measured near the pancreatic head? A, 3.5 millimeters. B, 3.5 centimeters. C, 2 millimeters. Or D, 0.356 centimeters. The answer is B, 3.5 centimeters. Bonus question number 3. Click on the falciform ligament. The ligament is right here. Now, can any of you guess what disease is demonstrated in this image? This image represents a patient with cirrhosis. Bonus question number 4. Based on the severity of this condition demonstrated in this ultrasound, the most likely cause is from what? A, trauma, B, metastatic cancer, C, SMA occlusion, or D, systemic hypertension. The answer is trauma, and this ultrasound represents splenic cysts. Bonus question number 5. What condition occurs when someone is born without a spleen? A, perisplenia, B, asplenia, C, nosplenia, or D, polysplenia? The answer is B, asplenia, or it's also known as right isomerism. Bonus question number 6. Gallbladder polyps greater than what are considered malignant? A, 7 millimeters, B, 1 centimeter, C, 5 millimeters, or D, 0.3 centimeters? The answer is B, 1 centimeter or 10 millimeters. Bonus question number 7. Click on the structure connecting the spleen close to the aorta. So where would you click here? This is why it's crucial to know your anatomy really well. The answer is right here. This is the splenic artery, which connects the spleen close to the aorta. Bonus question number 8. All of the following are mechanisms leading to this condition except A, hemorrhagic stroke, B, bacterial endocarditis, C, congestive, or D, thalassemia major. The answer is A, hemorrhagic stroke, and the most common cause of this condition is congestive. Bonus question number 9. The liver is usually more what compared to the spleen? A, echoic, B, hyperechoic, C, hypoechoic, or D, sonolucent? The answer is C, hypoechoic. Bonus question number 10. Which of the following is an abnormal gallbladder wall thickness measurement? A, 0.5 centimeters, B, 2 millimeters, C, 0.1 centimeter, or D, 2.9 millimeters? The answer is A, 0.5 centimeters or 5 millimeters. Bonus question number 11. What is the next step after measuring a dilated biliary tract? A, an investigation for urinary obstruction should be conducted. B, determine if the condition is chronic or acute. C, evaluate the pancreas for signs of choledocholithiasis. Or D, evaluate whether the flow direction has been inverted. The answer is C, evaluate the pancreas for signs of choledocholithiasis. Bonus question number 12. If cirrhosis is suspected, what is the next step? A, evaluate the kidneys carefully for associated cysts. B, evaluate the pancreatic head carefully for signs of a mass. C, an investigation for hepatic artery obstruction should be conducted. Or D, evaluate the spleen for associated splenomegaly. The answer is D, evaluate the spleen for associated splenomegaly. Bonus question number 13, and this will be the last of our bonus questions for this test. Which transducer placement will demonstrate the pancreas in order to measure the head, body, and the tail? A, longitudinally angled slightly laterally. B, transverse angled slightly superiorly. C, transverse angled slightly inferiorly. Or D, longitudinally angled slightly medially. The answer is C, transverse angled slightly inferiorly. And that concludes all the questions for this test. If any of you have any questions about your abdominal sonography boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can personally text me at 435-922-1635, and I will answer all of your questions that you need to know for your abdominal sonography boards. I'm Jim with ultrasoundboardreview.com. Thank you so much for watching.